Welcome to a step-by-step guide on trans-urethral male catheterisation. It's to be used in conjunction with the relevant key topics page found on Canvas. Step 1. Gaining consent. This involves introducing yourself, including your name and role, confirming the identity of the patient using at least 2 patient identifiable details, explaining the procedure, including exposure, the indication, any alternatives to this procedure, and the main risks, such as infection, discomfort, or minor bleeding. Then explain the need for a chaperone if you're a student. Invite any questions. Ask about allergies, specifically to latex. Inquire about any pain. And finally, obtain informed consent. Step 2. Gather equipment. You will require a clean, dry trolley to assemble all the equipment on. You will require a waterproof pad, 2 pairs of sterile gloves of the correct size, a foley catheter and another one of a smaller size, a catheter pack, urine collection bag, 0.9% saline, instiller gel, and 50 ml bladder syringe. Step 3. Set up sterile field. Begin with washing your hands. Put apron on. Now you're ready to open the catheter pack using an aseptic non-touch technique, ensuring you only touch the outside of the packaging. Open the instiller gel and catheter onto the sterile field. Keep the sticker from the catheter pack for the patient's notes. Open the catheter bag onto the sterile field. Fill the galley port with a saline solution, and open the 2 pairs of sterile gloves onto the sterile field. Step 4. Position the patient. Ensure the patient is undressed from the umbilicus to the knees, and cover the patient with a blanket or gown to maintain patient dignity until ready to commence the procedure. Position the patient supine with legs extended and slightly parted, making sure the patient is comfortable. Lay a disposable pad under the patient between their legs to absorb any urine that might leak. Wash your hands again. Put on a pair of sterile gloves. Step 5. Prepare equipment. Remove cap from end of instiller gel. Tear off tip of catheter pack by tearing along the perforations. Step 6. Clean. Uncover towel from patient and get patient to retract their foreskin, if present. Then fold sterile drape in half twice and rip the corner off to create a hole in the center of the drape. Apply drape with hole around the penis. Make a sling with the sterile gauze by folding it. Then hold the penis with the sterile gauze. Soak the cotton wool ball in the saline solution and warn the patient of a cold sensation. Then commence cleaning the penis using the cotton wool. Clean the glands of the penis away from the meatus using a single stroke. Then clean down the shaft. Use each swab once and dispose in the clinical waste bin. Step 7. Insert local anaesthetic. Holding the penis vertically with the gauze, insert instiller gel slowly, holding the penis vertically for a minimum of 2 minutes. Then discard of your gloves in the clinical waste bin. Step 8. Insert catheter. Wash your hands again. Put on the second pair of fresh sterile gloves. Place the tray between the patient's legs to collect any urine that might leak. Now insert the catheter into the urethral meatus. Ensure you're only touching the packaging of the catheter. Attach the end of the catheter to the bag promptly. Step 9. Inflate the catheter balloon. Attach the saline syringe and empty the contents into the catheter to inflate the balloon. Once inflated, pull back gently on the catheter until resistance is felt. Step 10. End of procedure. Reposition the foreskin, secure the catheter bag to the side of the bed or stand, and dispose of equipment and PPE in the correct bins. Recover the patient and ensure they're comfortable. Dispose of PPE in the correct bins and wash your hands. Step 11. Documentation. Finally, document and note the details of the procedure, including consent, indication, chaperone, the type of catheter, solutions and anaesthetic used, volume of urine drained into the bag when catheter first passed, any problems encountered when the catheter was being passed, that the foreskin was repositioned, confirm that sterile technique was maintained, a review date and signature, and affix a catheter packet sticker on the notes. That is the end of the procedure. Thank you for watching.